Here's a comprehensive and detailed explanation of the MMR vaccine. 1. Basic drug information. Generic name, measles, mumps, and rubella virus vaccine. MMR vaccine. Drug class, live attenuated viral vaccine. Drug forms, lyophilized powder for subcutaneous injection, requires reconstitution with a sterile diluent prior to administration. Brand names, MMR2, Merck & Co. Inc., Priorix. 2. Definition. The MMR vaccine is a trivalent live attenuated viral vaccine that provides immunization against measles, mumps, and rubella. These are highly contagious viral diseases that can lead to severe complications, including encephalitis, sterility, miscarriage, and death. The vaccine is designed to stimulate long-lasting immune protection. 3. Mechanism of action. The MMR vaccine contains live, weakened, attenuated strains of the measles, mumps, and rubella viruses. Once injected, the attenuated viruses replicate slowly within the body. This mild replication mimics natural infection, triggering the immune system to produce neutralizing antibodies, activate memory B cells and T cells. These immune responses prime the body to recognize and fight future exposures to the actual viruses effectively. Hammer 4. Uses. The MMR vaccine is primarily used for active immunization to prevent the following: measles, rubella, mumps, rubella, German measles. It helps prevent outbreaks and serious complications such as encephalitis, orchitis, deafness, congenital rubella syndrome in infants born to infected mothers. 5. Indications. The MMR vaccine is indicated for routine childhood immunization. First dose, 12 to 15 months of age. Second dose, 4 to 6 years of age. Catch-up vaccination for adolescents and adults without documented immunity. Preconception immunization in women of childbearing age, non-pregnant, healthcare workers, travelers, college students, and those in close living quarters. Post-exposure prophylaxis in some cases of measles. 6. Contraindications. Do not administer the MMR vaccine in the following cases: severe allergic reaction to a previous dose or any vaccine component, e.g. gelatin, neomycin. Pregnancy. Immunocompromised individuals, including HIV/AIDS with severe immunosuppression, cancer patients on chemotherapy, organ transplant recipients, recent receipt of immune globulin or blood products, moderate or severe acute illness with fever, history of thrombocytopenia or low platelet count. 7. Precautions. Before taking this medicine, inform your doctor or vaccinator if you are pregnant or plan to become pregnant within 4 weeks, have a weakened immune system due to illness or medications, e.g. steroids, have received a blood transfusion or immunoglobulin in the last 11 months, have a history of allergy to gelatin or neomycin, have HIV/AIDS, vaccine may be safe if CD4 count is high, have a history of seizures or family history of seizures, are taking immunosuppressive medications. Special note: avoid becoming pregnant for at least 1 month after receiving the MMR vaccine. Hack 8. How to use. The MMR vaccine is administered subcutaneously, preferably in the outer upper arm deltoid or anterolateral thigh in infants. Administered by a trained healthcare provider. The vaccine must be reconstituted using a diluent before use. 9. Dosing information. For children, first dose at 12 to 15 months of age, second dose at 4 to 6 years of age can be given earlier, at least 28 days after the first dose if needed. For adults, 1 to 2 doses at least 28 days apart for adults born in or after 1957 without immunity. Healthcare workers, travelers, college students, and others at higher risk should receive 2 doses. Special note: during outbreaks or exposure to measles, mumps, or rubella, post-exposure vaccination within 72 hours may offer protection. Not 10. Missed dose, overdose. Missed dose. If a dose is missed, it should be given as soon as possible. There's no need to restart the series. Overdose. Accidental overdose is rare due to clinical supervision. If multiple doses are administered, monitor for increased side effects. 11. When to stop or avoid taking. Avoid taking or stop further doses if there was a severe allergic reaction, e.g. anaphylaxis, to a previous dose. You are currently pregnant. You have developed thrombocytopenia after a previous dose. You are undergoing immunosuppressive therapy. You recently received antibodies or blood products. 12. Side effects in detail. Common side effects: mild, redness, pain, or swelling at the injection site, low-grade fever, mild rash, headache, swollen lymph nodes, temporary joint pain or stiffness, more common in adult women. Moderate side effects: fever over 39.4 degrees, 103 Faves, febrile seizures in young children, temporary low platelet count, thrombocytopenia, parotitis, swelling of salivary glands. Rare serious side effects: allergic reactions, urticaria, wheezing, anaphylaxis, encephalitis or encephalopathy, extremely rare, aseptic meningitis linked more to earlier mumps vaccine strains, deafness, extremely rare, severe allergic reactions to neomycin or gelatin. 13. Vital information. Effectiveness: 97% effective after 2 doses. Live vaccine: do not administer to immunocompromised or pregnant individuals. Storage: refrigerate between 2 degrees Celsius and 8 degrees Celsius. Protect from light. Duration: usually lifelong after 2 doses. MMR and autism, no link exists, debunked scientifically. NAR 14. Other drugs that will affect MMR vaccine. Medications that can interfere with the MMR vaccine. Immunosuppressants, e.g. corticosteroids, chemotherapy, biologics like infliximab, high-dose corticosteroids, e.g. prednisone 20 milligrams per day for 14 days, immune globulin or blood transfusions within the past 3 to 11 months, other live vaccines, e.g. varicella, yellow fever, give same day or 4 weeks apart, antiviral drugs, e.g. ribavirin, that may suppress replication of the live virus. Thank you. Have a nice day.